Welcome back to Series 6 on Pedicures by Trieu London. So in the first video, we went over introduction, preparation, foot diseases and disorders, foot anatomy and physiology. In today's video, we will be going over treatment and contractions. So let's get started. So again, this is just a general guidance to pedicure treatment. You can vary this according to your style or your salon, and you can make additional tweaks where you would like to. Firstly, filing the toenails. So you should always use a 20/40 grit file that is flexible. And this other main point is it's important to cut the toenails straight and shape into a square to prevent ingrown toenails. Cuticle work. After foot soak, which helps wash away dirty particles from the free edge and softens the cuticles, cuticle work can be carried out. Again, as mentioned before, if accidents do happen and there is bleeding, use a lint-free wipe and an antiseptic spray. Buffing the nail. So again, use the less abrasive side against the cuticle and buff the nails to help smooth ridges, create the shine, and reduce stain on the nails. We then move on to the pedicure massage. This should usually be included in a massage, and is more commonly included in a massage. It's very important that you actually follow a routine and all the movements should be fluid. Benefits of a massage is obviously to stimulate blood and lymphatic system to increase flow of nutrients, helps the client relax, and also nourishes the skin, leaving it smooth and soft. We have covered most of this in the manicure series, but just as a kind reminder, so we have three main types. We have the effleurage, which is a light movement to begin with. The pressure is very little, and it just removes the loose surface skin cells. We then have the pedicures, which is a slightly deeper movement. It includes stretch, squeeze, and releasing the muscles, and will start to increase the blood flow. We then have the third one, which is much deeper movement. It's friction, and it's where the therapist uses their thumb and fingers to loosen muscles and joints. Again, if you're adapting a massage for men who have a lot of hair on the bottom part of their feet, then you'll need oil instead of cream. Skin conditions, if it's oily, then use less. If it's elastic skin, then try not to stretch too much with your massage manipulations. Again, with older clients, you need to be slightly more careful and always checking with the client. So I like the paraffin wax treatment can be done on the manicure, as in the hand. It can also be done on a pedicure. So again, the paraffin wax is a luxurious treatment, and you do need to check for contraindications. So any nail diseases, skin infections, allergies to the product, bruisings or open cuts, you want to then not carry out the paraffin treatment. Its benefits are as follows: to rehydrate the dry skin, relax tension on the muscles, and improve inflamed joints. So similar to the manicure, in fact, it's very similar. You'll need the following equipment: the paraffin wax heater, polythene bag, and a towel and mitt. So you can, number one, you need to place the wax heater on before treatment, and allow the paraffin to warm up to a working temperature. Apply foot cream or feet oil, or oil to the feet rather. Test the wax on your wrist. Ask the client to test the temperature of their toes. Then when you support the client's foot, apply the wax with a mask brush generously over the entire foot, including the toes, right up into the ankles. Then cover it with a polythene bag and wrap in a towel or place in a mitt. Repeat on the other foot and leave the foot wrapped for 10 to 15 minutes. Gently slide off the polythene bag and the wax should come off with it, and any residue to left should be lightly brushed off with a towel. And then finally, you want to end it with application of cuticle oil and massage in excess cream. So similar to before, like a classical manicure, you have to painted the nails. So these are the toenails. Again, it's a similar fashion. So you 3 strokes. So center, then left, then right. Of course, if it comes to the pinky toes, you can work in small dabs. You don't need to actually stroke. There won't be space to actually stroke 3 coats on each, from center, left, and right. So work as you go along and use your initiative. But remember, practice, it'll become something you'll be quite instinctually used to. A free owner doesn't really occur in pedicures. You too can get French. It's quite common to have French on pedicures and also then the traditional polish. Again, nail storage should be in a cool and dark place. And if there are any allergies to the polish, then it should be stopped. And if there's any diseases or disorders around the nail plate of the toes, then you should not carry out the treatment. Again, these are simple reasons for chipping on the toes. If there's grease left on the plate, no base coat was applied, or the nail plate was flaking. Okay, so that's not applicable here. And then reasons for peeling: successive coats were not given enough time to dry, there's grease again left on the plate, or no top coat was used. So we then not finish off, but we then have the procedure of the pedicure. So what do you actually do in the process? Okay, so again, it's all about practice, but we generally find is pedicures tend to be easier than manicures in terms of the final finish. So let's actually go through the steps. So once you've completed your consultation again and you've concluded that there are no contraindications stopping you from completing the pedicure, sanitize your own hands and the client's feet with antibacterial spray or foot spray. Remove any existing nail varnish from the nail plate so it's visible with nail polish remover. Again, check for contraindications and see if it's clear to proceed with the treatment. And if you're unsure, if you find something on the foot that's the client didn't mention, then refer them to the GP. So using your sterilized nail cutters, cut the nails straight across. That's the important point, specifically for pedicures. Finish using the file to smooth and straighten the nail shape. Apply cuticle cream or cuticle remover to the cuticle area to both feet, slightly rub with them using the pad of your thumb. You then place both feet into the pedicure bowl and allow feet to soak for around 5 minutes. During this time, select the color or discuss the required finish. Remove the right foot and dry using a towel. Use a sterilized cuticle hoof or pusher, and push back the cuticles firmly but not causing any discomfort to the client. You then use a cuticle nippers to finish and neaten off around the cuticles, removing any hangnails or excess cuticles. And then return all the tools to the barber side when not in use. Repeat the cuticle work on the left foot. So you bring out the left foot, dry it out, and then you do the same. So using the foot file, which is almost like a foot scrub, work on the hard areas of the right foot. At all times, always placing the foot back into the bowl so it's soaking. So the foot file is almost like a little block, and you're scrubbing that. It's almost like a pumice stone block where you're scrubbing off hard skin. This will help soften the skin and break down hard skin on the feet. You then want to apply almost a 50 pence size exfoliator, rub it into your hands, and then work it into the right foot and the right leg, just above like almost the ankle area, and then rinse the foot in water and dry thoroughly. You then repeat the same foot filing and exfoliating with the left foot, and at that point after this you don't need to put the feet back into the bowl because you've rinsed them and you've dried them thoroughly. You then apply cuticle oil to the cuticles of the right foot and complete a leg and foot massage, and then you repeat the same on the left foot. If you're performing a paraffin wax treatment, then Then apply both feet up to the ankle, cover and wrap in 10 minutes. Remove thoroughly or massage in any remaining marks. Squeak the nail plates with polish remover and remove all traces of oils. So then you can then start with the application of polish. Now with the toes, they are quite close together, so you will need a separator. So use a separator to divide the toes. And then again, similar to the manicure, base coat, top coat, so 2 times color, then top coat, and then quick dry. Allow the client to actually relax for a good 10 minutes to ensure that the nails are fully dry. And in this time, you can place all the tools back in the autoclave or sterilize them. So it's always advised that the client has open toe shoes, so sandals, which will make sure there's no smudging. In any case, they might have come in closed toes, so like trainers, boots, then you can wrap in cling film. But make sure you give a loads of time for the foot to actually dry, as in the paint on the foot. So going to the pedicure massage. So you'll need to warm the lotion before applying to the client, and it's approximately 6 minutes per foot. So number 1, you first want to support the client's ankle with one hand and use effleurage strokes using the palm of your hand from the top of the foot, so that's your toes, all the way just to below the knees. Repeat that 6 times. Okay, and then so once you've actually done the effleurage strokes from the top of the foot to the knees 6 times, you then want to support the ankle with one hand and knead the back of the leg. So that's the gastrocnemius, the big muscle on the lower leg. Then you use your palm working up from the ankle to the back of the knee, and then using your forefingers circle the ankle joint. So you're just doing small circles. You then use your thumb to apply friction, so that's the third technique, between the metatarsals and small circular movements, using small circular movements. And then you apply small circular movements to each individual phalanges, working massage cream into the cuticles, so that's each little toe. Using your palm, deep knead the sole of the foot. So obviously the client's foot will be facing you, using firm pressure, because remember they are using a lot of pressure in the day for that. And then use your thumb to pressurize small circles movements up the sole of the foot. So rub your thumbs in small circles into the sole of the feet. You then repeat the first movement of effleurage to the foot and leg 6 times to finish. So that will be one leg, and then you repeat the same process on the second leg, each leg around 6 to 7 minutes, and now the massage is complete. Again, for adapting the massage itself, male clients, you want to file their nails shorter, colors usually omitted. You want to use oil and instead of cream to avoid dragging their hair, and use deeper movements in the foot massage. Finally, on this topic of Series 6 on pedicures, let's just go through contractions and aftercare. So there can be some cosmetic ingredient reactions, such as redness of the skin, swelling, itching, raised blisters. So the symptoms do not necessarily appear on the hands in this case. So this is maybe with the foot, it does usually appear maybe on the foot or maybe higher up on the foot, but you need to be aware of the feet and the foot. And sometimes it can show up on the face. So if there is an allergy, then you need to remove the offending product. Use water. Obviously, in the case of polish, use a polish remover. And if the symptom persists, then seek GP advice. Now, it's very important that you give aftercare advice to your client after a pedicure. So let's actually go through what that entails. So it's very important that your clients are aware of how to look after the nails in between treatments. So here are some general points. So they should always apply cuticle oil to the cuticle areas. For their pedicure specifically, wear spacious and comfortable footwear. Use non-acetone polish remover if they are trying to remove the nail enamel or varnish. I'll keep that as varnish here. Apply daily foot cream to keep the foot smooth and soft. Also apply top coat every day or every other day to ensure the polish remains fresh. Buff the nails once a week. Return to the salon for regular treatments. And if they are going to file the nails, then again, in one direction and use a 240 grit. In terms of, say, washing the foot, you can use mild soaps or even hand cleansers for the foot, which are not too drying or irritate the skin. Use a foot scrub or foot file, so it's almost like a small block to prevent the buildup of hard skin, which they could probably buy at the salon. And they should always check the soles of the feet for any foot conditions or infections. In general, eating healthy is always great. Use nail strengthener to reinforce weak nails. Mentioned before the 240 grip file, and then to buff the nails to help a pink shine. So that's it for today's video, which formed part 2 of Pedicure Series 6 on nail theory. I really hope you enjoyed this video. Please comment, subscribe, and like, and thank you for watching.